Colon cancer. The colon or large bowel is the terminal portion of the intestine that measures between 3 and 5 feet. The first part of the large bowel is the cecum, into which the ileum empties. The appendix is attached to the lower pole of the cecum. The cecum continues as the ascending colon. Near the undersurface of the liver or hepatic flexure, the ascending colon turns and is now called the transverse colon. This is the longest part of the colon. At the lower pole of the spleen, the colon again turns, this time downwards, and becomes the descending colon. The descending colon continues as the S-shaped or sigmoid colon. The colon absorbs water from the roughage. The terminal 15 centimeters of the colon is called the rectum and helps in defecation. Colorectal cancers are the second or third most frequent cancers in the developed world. Incidence of colorectal cancers has been low in the Indian population. However, with rapid urbanization and changes in dietary patterns, this is changing. Dietary factors are most important in the development of colorectal cancer. Dietary fiber available in the traditional Indian diet is highly protective. Vegetables and fruits and traditionally unpolished rice, wheat and cereals are rich in fiber. Dietary fiber alters the fecal pH favorably, dilutes the concentration of fecal cancer-causing agents or carcinogens, and reduces the transit time of the colonic contents, thus reducing contact time between the carcinogen and the large bowel mucosa. Excessive intake of meat may promote cancer. Vitamins and minerals, again plentiful in the Indian diet, are protective. Tobacco smoking confers a 3 times increased risk of colorectal cancer. Daily alcohol consumption increases the risk of colorectal cancer twofold. Lack of regular physical exercise and obesity also promote development of colorectal cancer. Individuals with inflammatory bowel disease, such as Crohn's disease or ulcerative colitis, those who have had prior radiation for other pelvic cancers, individuals with a previously treated polyp or colorectal cancer, and those who have had removal of their gallbladder previously are at higher risk of development of colorectal cancer. Hereditary factors play a role in a small set of patients. Alteration in bowel habits in the form of unexplained, persistent and refractory diarrhea or constipation, or a combination of both, persistent mucus discharge through the rectum, or mucus diarrhea, black tarry stools, presence of blood in the stools, unexplained weight loss, fatigue, unexplained anemia, and recurrent abdominal pain are some of the manifestations of colorectal cancer. Occasionally, they can present as an acute surgical emergency. Diagnosis of colorectal cancer is usually made after a thorough clinical examination and often a colonoscopy. Colonoscopy is an endoscopic procedure wherein a lighted tube with a camera is passed through the anus into the large bowel. The insides of the large bowel are visualized and a biopsy taken from any visualized abnormality. The procedure is painless and is performed under mild intravenous sedation. The large bowel is washed out before the procedure. Virtual colonoscopy can now be performed, though biopsies cannot be taken. Investigations like the ultrasound, CT scan, and the MRI scan are used to see how extensively the cancer has spread to stage it. Tumor markers that are blood tests to assess the cancer are also useful. Treatment of colorectal cancers is predominantly surgery. This involves resection of the diseased portion of the gut along with the draining lymph glands. For cancers in the lower rectum, the surgery would involve removal of the entire rectum and fashioning of a permanent colostomy. A colostomy is a portion of the large bowel which has been brought outside to divert or provide an alternate pathway for evacuation of feces. Management of a colostomy is not inconvenient or difficult. and when appropriately managed, need not hamper the individual's lifestyle. Normal professional activities, interpersonal relationships, and sexual life can be resumed after treatment. Chemotherapy and radiation therapy play a role in a select set of patients. Treatment of early colorectal cancer results in cure rates of over 80%. Advanced disease has much poorer results though. In high-risk individuals, screening for colorectal cancer using periodic colonoscopy can help detect this cancer early. Colorectal cancers are in some sense preventable because their genesis is influenced by lifestyle. A healthy lifestyle with a well-balanced diet that includes plenty of vegetables, regular exercise, and abstinence from tobacco and excessive alcohol use will go a long way in prevention of many cancers. Our fear should not be of the diagnosis of cancer, but of delayed diagnosis. Early diagnosis enhances cure rates, reduces cost of treatment, and reduces side effects or morbidity of treatment.